Hi everyone, this is Dr. Siew. Today we're going to talk about a medical condition related to scars, keloids and hypertrophic scars. When we get a wound, our body heals by forming scars. You can tell the difference between scar tissue and normal tissue because scar tissue is often harder and fibrotic and it is whiter in color. However, when the scar tissue formation becomes excessive, keloids will form. Keloids actually behave like tumors in that they grow out of the original wound margins and they rarely regress. They continue to grow over years. Hypertrophic scars are similar, however they are less exuberant and aggressive. Hypertrophic scars do not grow out of the original wound margins. Both keloid and hypertrophic scars can result in unsightly scars. While we do not know the exact cause of keloids, we do know that genetics play a large role. People with darker skin types such as Asians, Hispanics and African populations have a larger chance of developing keloids compared to Caucasians. Specific skin sites are also more prone to keloids. These include the front chest wall, the earlobes and also the shoulder blades. A trauma is required to trigger the formation of a keloid. Besides their poor aesthetic appearance, keloids can cause distress to patients. It can cause itching, pain, and even restriction of function when they occur over joints such as the elbow. For this reason, many patients seek treatment for their keloids. The treatment of keloids is often very challenging and also controversial. Different doctors have different protocols and their preferences for treating keloids. The first-line treatment of keloids include using pressure dressing and silicone sheets. This is also good to prevent keloids in people who are prone to them. Traditionally, the most common form of treatment for keloids involves injecting corticosteroids into the keloid. This treatment is repeated monthly and you have to do it several times. The problem with the treatment is that the keloids often recur. After injection, you may see improvement for 2 to 3 weeks, but it starts to recur again after a month. Therefore, you require multiple treatments over a long period of time. In addition, after a few treatments, the skin starts to thin and you may get this red appearance of the keloid. So even though you have flattening of the keloid, the appearance does not improve. Lasers have been used to counter this problem, so we use vascular lasers like the pulse dye laser and the dual yellow laser to improve the redness associated with keloids and the injections. Doctors have also used resurfacing lasers like the erbium YAG to increase the efficacy. However, all of these treatments present with their own problem with variable success and it requires very strict patient adherence. One treatment which has shown a lot of promise in the treatment of keloids is using botulinum toxin, commonly known as botox. In this treatment, botulinum toxin is injected into the keloid and around it. We do not know exactly how it works, but we believe that the botulinum toxin decreases the muscle tensile strength which pulls the keloid apart. It also inhibits the growth of the keloid by modulating collagen deposition and inflammatory cytokines. Using botox to treat keloids have shown great promise. The results are not only better and faster compared to intralesional corticosteroids, but also you not only get flattening of the keloid, but better skin color as well. The keloid blends in better with the rest of your skin and has a better aesthetic outcome. At Radium Medical Aesthetics, we use a combination to treat keloids, depending on how aggressive the keloid is, the color, the size, and also the patient's budget. Importantly, we customize the treatment according to the skin condition. Speak to your doctor to learn more about keloid treatments and how the different methods of treating keloids can help you.